Welcome back to The Line. Data recently released by the Alzheimer's Association shows that New Mexico is expected to see a nearly 36% increase in diagnoses of the disease in the next 7 years. That's the fourth highest growth rate in the nation. The report also predicts that the number of patients in New Mexico will rise to 53,000 in 2025. Laura Sanchez-Rivey. No one really knows why this is happening, but does that number shock you when you first read that? I mean, 2025 is around the corner, for gosh sake, but a lot of implications we're going to get to. But right off the bat, were you surprised by that number? Did that catch you off guard?
I think it's a big number, but I know that it's increasing. I mean, the instance of it, a lot of people are affected by this, and it's a really difficult thing to go through. I think anybody who's had a family member that's been in memory care or has been at home that they're dealing with. I mean, even just diagnosing the early signs of it, and sometimes it's dementia, it's certain issues, but then the actual diagnosis of Alzheimer's. That's what's interesting to me is the number was really high with regard to Alzheimer's in particular, but I bet the numbers are much higher when it comes to dementia, which has not yet been diagnosed as Alzheimer's, and we see a lot of that. And unfortunately, we have an older population. Folks are getting older. People are living longer, but that doesn't necessarily mean that the quality of life is there, in later years. And so there's a lot of resources out there, but I think there's still a lot of information that people don't understand about the disease and the amount of care that goes into it and the huge toll that it takes on family members. And I think it's really a public crisis that we need to address.
That is not an overstatement in my mind. When I hear, public crisis, Lieutenant Governor, I agree with that. It really, when you think about the burden on families coming up here, there's really not a lot of help. It's a little difficult, isn't it, for families to kind of get in.
Well, I think there's a couple of things. One is when you're a family member taking care of you, that means you're not doing something else, like you're not employed in the public sector. It pulls a lot of, especially women, out of the workforce, take care of parents or maybe in-laws, people that are in their homes. And so I think that's one thing that we need to consider. I also think, with the demographics of New Mexico as they now exist, which is an out-migration of younger people and an older population of people who've lived here, it's not really a surprising number. And it's going to be a real strain on the home health care business or the healthcare business. This is the place where there'll be plenty of jobs in those sectors. I know we spend billions nationwide on Alzheimer's research. We don't spend as much money on quality Alzheimer's memory care facilities that to be made available, which is why so many people leave the workforce to take care of family members. So it has an economic effect even beyond the fact that we have these healthcare costs, is pulling people out of the workforce to stay at home to take care of loved ones and who can't be left alone.
That's right. That's
and
right.
It's a very difficult thing. I think some of us around this table have had to deal with those kinds of diseases, and it's and then it creates another health situation many times in a family where the health caregiver becomes ill.
That's a common, exactly right.
Very.
Yeah, exactly right. Tom, the financial, one can only just let your imagination run wild on the finances here for the state of New Mexico. The Lieutenant Governor makes a good point. Home health care is going to be perhaps an opportunity. It's a big business in other states. How do we get in front of this? I mean, is this an opportunity for us to have a call to action here? And then what do we do once we have the call to action? It's going to be very difficult.
Yeah, well, the first part I think is just awareness that it's a growing issue. It's an issue now, and it's an issue that will continue to grow. I have a parent who suffers from Alzheimer's dementia, and it does take a tremendous toll on all the different family members.
Right.
With that in mind, what my next comment isn't a slam against the Alzheimer's Association, but I think this massive research that has been put out has a lot of conflicting data or data that needs a little bit additional scrutiny. Case in point being the report shows that there's 2% of New Mexico's current population that's currently diagnosed as being with Alzheimer's. And then they also say in other reports that at least 107,000 people are out of the workforce, as the governor has said, serving as caregivers. And that's 10%, or I'm sorry, that's 6% of our population. Wow. So to have 6%, which is, I believe, servicing 2% of the population.
Right.
Those numbers don't really, there's no explanation as far as how those numbers add up. Now, with that said, I can tell you that between my brother, sister, and myself, and my mom, it takes a whole family, it takes a community to really help in these particular situations.
That's right. Interesting point there. Dan, the idea that it perhaps could be a bigger problem for more rural parts of our state than here in Albuquerque. Do you see that as well?
It's
distances
it's
involved,
definitely
or?
a huge problem. I mean, with Alzheimer's patients, and I was fortunate not to have to suffer that with both of my parents.
Right.
We did not have to, and I feel for those that have had to deal with it. Healthcare is a tremendous issue. I mean, dealing with everything from kidney problems and infections and on and on and on, and to eating right. I mean, you just can't. You can't live in Hillsborough or Cloudcroft and say, I'm going to do this. I mean, you've got to be within driving distance. One of the things that I think may be taken a little out of context in this article, I had met a lot of folks when I was in the legislature that lived in Roswell that had loved ones suffering from dementia. And the reason they were there is cost of living, right? They were able to say, listen, we lived in New York, or we lived in Chicago, or we lived, first of all, weather. Right? I mean, dementia patients were not doing well living in snowstorms.
Right.
The second thing was they were able to sell their homes and take their $90,000 a year retirement that they got working for the state of Illinois, moved to Roswell, and they were able to take care of their significant other in a way that they couldn't in a place like Chicago. So, I mean, there's also an opportunity with us putting this money into this, that what people have to remember is that while we're talking about this number increasing and having to take care of these people, more often than not, it's either a spouse and or someone much younger taking care of that person with Alzheimer's. So it's an opportunity in New Mexico to say, okay, look, how do we get these folks to realize that we have the tools to help their loved one, and then give them an opportunity to succeed later on once they're here, and keep them in the state of New Mexico and make them become, good tax-paying citizens in New Mexico, and let them be able to help others. We see that out in Rio Rancho with all of the facilities. The big thing that's going on now across the country is the buy-ins, right? You can buy in now, and it's like living in a condo. Then it's partial assisted living, all the way up to the Alzheimer's units.
And they have that here.
They do, and they have it here. And then, but that's kind of become a big business in the last
But
5 to 10
that's also,
years.
that's very much an urban,
Yes.
right now, an urban solution.
That's right.
When we go into some of these rural areas, that's just not a viable solution for a lot of people.
That's
There's
right.
a lot of limitations. And one thing I think that's important to bring up too, and I had to deal with this in my family. My mom had dementia, and she lived in Deming, and it was there's cultural issues. And the cultural issues are that she had a real fear and a real just problem going to doctors. And I think that this just having a limitation in terms of accessibility to the right doctors, the right care, but also an unwillingness to kind of submit to that, to the kinds of care that you need when you're going through these kinds of conditions. That's a limitation. I think we have a population where that is the case, and whether it's rural or urban areas, I think that the lack of care, the lack of education in terms of making sure people understand what they need to do to address an issue, and the preventive care that you need leading up to those moments, that's a real gap that we have.
That's right. Good point there. Got about 30 seconds left. I want you to get in on the rural parts of our state and your thoughts about that and the difficulties, the challenges.
Well, I think it's what's going to drive continued depopulation of some of these very small rural places, because Dan mentioned my little favorite community, Hillsborough, but many people there are older, and we've already seen it happening as they are impacted, or that somebody has to they leave the community and there's not really the replacement of younger people in that community to populate the community. They go where the health care or where the memory care unit is, or where there's somebody. And something we haven't mentioned, not everybody has a family member who will take care of them.
Thank you. That's exactly right.
That's a lonesome, lonesome road.
Yeah, absolutely. We have to wrap that there. Thank you all for your thoughts this week. Good stuff.